We're in the studio today to talk about Breast Cancer Awareness Month and the Richland Hospital, their imaging team. And we have members here today, Director of Mammography, Marcia Jones, and also we have Jessica Shaw here as well. They're both of that department, and glad to have them in here to talk about a very timely and a very important subject. So good morning to you, ladies.
Good morning.
Appreciate you coming in here today to talk about this. Marcia, we'll start with you because you have been the longest tenured here of the two. How long have you been with Richland Hospital?
Almost 40 years.
40 years, wow.
Yes, mammography was just starting out. We were doing mammography on Xerox paper at one time with blue powder, and you magnetized the plates, and you it did the x-rays with the actual x-ray tube, and you had the Xerox paper. I always thought it was a Smurf all the time because I was all this blue powder. But so then it changed, and we've got our first mammography machine, and everything kind of changed. We got a different one, and then it became digital, and then now with our new machine is a 3D digital. So it's a tomosynthesis, so much more detail, and the information is just wonderful. So
much more accurate, I'm sure, now, too, isn't it?
Yes, it's much better for our patients with dense breast.
Right. Yeah, I can't imagine that going back to the Xerox or whatever that was.
Yeah, that's completely gone.
Back then. Man, that is something. You're here just to kind of get the point across about how important early detection is, correct?
Yes, it is. Early detection saves lives. You want to get, screened early after 40. If you have a, high risk parent, a mother, say the mother was, 40 at her onset of breast cancer, they would screen that lady at 30, 10 years sooner.
Okay.
So earlier is better for them.
Jessica, at what age should women start to think about getting a mammography?
So the best number is to say 40. It kind of can go, you hear different things, different organizations say different things. Best number we suggest is 40. But like Marcia said, there's different reason to start earlier. It's always important, though, to get that baseline. So there's a lot of people that just, don't really want to do it. Which we understand, but having that baseline so that as you age, they know how things are changing as you're aging.
I think it's like a lot of things. We put it off thinking, maybe next year or whatever. It's not something that you always look forward to every year.
Yeah, no, it's not anyone's favorite thing, but they are quick, in and out in 15 minutes typically. They're not as bad as they get the reputation of. We can speak for our department, but we have 4 great mammotechs that all do a very good job. So,
who are the other mammotechs?
We have Shalise and we have Wendy. They also do mammos with us.
Okay.
Yeah.
You offer 2D and 3D imaging. Could you talk about that and the difference?
Yeah, so 3D is the tomo that Marcia was talking about, which we do on all patients. We do have the ability and at times do a 2D image. The 3D is more detailed due to it's taking multiple pictures, and we kind of describe it as a loaf of bread. So when you look at a loaf of bread from top to bottom, you can, it's straight across. There's not, you can see the air pockets in here and there. But when you pull out a piece, you can see, this one actually has a hole in it, how it looks different. So they kind of can roll through the images to see within your breast a little bit deeper, so that if there's an area that would normally be covered up just top to bottom, they can kind of see that. So we do both, but it's usually together. So we'll do a 3D, and if we need an extra picture, we'll just do a 2D image in addition to the 3D.
Patients have a choice then?
They do. They don't have to do 3D. I don't think that happens very often. There are patients that may not be physically able to do a 3D just because of some of the angles. But I don't think I've had anyone ask for a 2D only because insurance covers 3D. So why not? Really, it doesn't change anything. It doesn't, other than 3D is better. So
The exam is still the same,
for the most part, really. I mean, there's some angles of the tubes that sometimes variables on body habitus, with shoulders depending, can get in the way. But we typically most people we can still do it on.
The ability to hold still is the big part with 3D. If you got a patient that maybe has MS or has a tremor, sometimes those patients are a little bit harder to get to hold still for that, the 3D mammogram. So sometimes we'll do a 2D image on them just because it's, you can get a better image and you don't have to worry about the patient moving and the tube moving at the same time.
What is the average wait time, Marcia, if someone's going for an exam?
To be scheduled, or
the average wait time, as for a screening, like if you go there, do you hear the results then that day, or does it, you get a call later on, or how does that work?
Our images go to UW One South Park, and they read them. The radiologists read them, and then the report will come back into our computer. We send a patient a density letter in the mail in about 5 to 6 days. This result. The result goes to their doctor right away, so they would get the results from their doctor. And it also goes into the patient portal.
I see. How much is preventative? And you talk about, hereditary for breast cancer, possible breast cancer. Are there some things that you can do in terms of diet and those kind of things, Jessica?
I think no. Not really. I would say, diet's important in general, that you're more healthy, but there's not that I am aware of anything that's like you need to stay away from to help with that. Just like anything, being healthy is beneficial, but it doesn't make or break anything.
So weight doesn't have anything to do with, the likelihood or, the possibility, a higher percentage?
No.
Okay.
No. Not that I am aware of. I mean, I haven't heard of any studies that are basing that on that.
You both are wearing pink. And that's we see that all the time. I make the rounds for volleyball matches, and a lot of these teams are having digging for a cure or pink nights. But pink is the color for breast cancer, correct?
Correct.
And you're wearing some nice shirts here today.
Thank you. Yes, and they got the Richland Hospital.
Richland Hospital, the shirts there. So, and that's a nationwide thing, right?
Yes, even with the NFL teams, you'll see the pink shoes and the different colors and stuff now. For they always have their pink night and stuff out there. So
proud to wear pink.
Yes, yeah. A lot of them, the football players, their grandmas and their mothers had breast cancer, so they all wear it in support of them.
Mm-hmm. And there are lots of fundraisers and nationwide, a lot of walks and things going on. Correct?
Yeah, I think any cancer, everyone's been affected some way, shape, or form. But I think breast cancer, is just it's I think been looked on a lot longer than some of the other ones, and they've kind of taken and ran with the pink, and everyone knows someone, one way or another, that has been affected with breast cancer.
Yeah, most definitely. But I think in terms of the cancer, the colors that you wear, I think pink might be the one that people know the best,
yeah.
Right?
Oh, yeah, for sure.
Yeah, because of its visibility and whatnot. So as far as Breast Cancer Awareness Month, is the Richland Hospital doing anything special? Do you have any ties with that to go along with that and information?
Our patients, when they come in, we do have a few handouts to give them and shower cards, and we do have, a plantable seed pack to give them in a bag for breast cancer awareness. But we just...
Mm-hmm.
Yeah, we do our best to make it known, and we like to thank people, too, for coming, just because it is important, and I think sometimes it gets a little bit bound, just like there's all these screening things you got to do for everything, and this is our world, so we make sure to thank them, especially in October, for coming.
Mm-hmm. Yeah, certainly. You encourage that at any time, any time of year, but especially in October. That's for sure. I know the hospital's doing some other fun things here. You've got celebrating 100 years. Were you guys involved in the walk that they did in September? Did you get involved in that?
I was working that weekend.
Oh, you had to work
But
that day.
I heard a lot about a lot of people participating, so it sounded like it was a good turnout.
Yeah, I wasn't able to make it either. I was signed up, but then found out I needed to be somewhere else for my kids. So we didn't make it, but it looked like a really good time.
I heard it was a good time and
it
good
looked awesome.
good turnout for that, celebrating 100 years. But there's a free movie night coming up. So
Yeah, that's pretty exciting.
make your plans now. And that's, in fact, this Saturday. Gates open at 5:30. The movie starts at dusk at Starlight 14 Drive-In. That's free, right, everybody? You don't have to be involved with the hospital or work for the hospital or anything.
Nope, it's a community event. Come on out and take the kids out to the movie and have fun.
Hope a lot of people will certainly do that. A couple of other things about breast cancer screening. We were going to talk a little bit about diagnostic and some of those things, and in those terms. So, Jessica, maybe you could talk about that.
Yeah, so we've been doing diagnostic for 3 years, which has been amazing for the community. So either there's a couple different ways you can be coming for diagnostic. One, if you come for a screening and you are called back. So there's an area of concern on one or both breasts that they want further evaluated. They'll call them back and we'll do some diagnostic imaging, usually an ultrasound to follow. Or if you find a lump or are having like a pinpointed pain or something just isn't right, we need to do some extra imaging. It's called diagnostic. And we do those on Fridays when we have a breast radiologist. So everything we do is dictated off of what the radiologist wants us to do. So we could go through everything that we do. They may see another area or want further images. So it's really nice we do what we need to do, and when we're done, the patient knows if they need a biopsy or they need a follow-up or everything's good and it's just some overlapping breast tissue. So it's been great that we've been able to do that for the community. It saves a lot of extra travel and a lot of cuts down on nerves too.
Yeah, it has to be. To have the radiologist there once a week, Marcia, that's got to be a godsend, isn't it?
It's wonderful because you can run all the pictures past them. They decide if we need anything else. They need an ultrasound. They do the ultrasound. Patient gets the results while they're there. So they like that. And so everything's right up front. And it just takes care of that anxiety.
Mm-hmm. Many times, I'm sure it's just precautionary, right, Jessica?
Yeah, a lot of times it isn't cancer. You have those spurts where it seems like there's more, and then like they can be cysts, they can be breast tissue, they can not for sure what it is, and that's where I was talking before about having your screenings and having a baseline and to know what's normal. Because if they see an area that wasn't there 5 years ago, but you've had mammos consistently, they can say, okay, that area has been progressing and now it looks bigger. I kind of saw it there. I do think we need to follow that up, biopsy it, or do follow-ups. So they all kind of run together and work together to find out the end game.
Could there be a cancer present, Marcia, without a lump?
Yes. I mean, you can have a cancer that you don't feel anything, but we come in and we do a mammogram and maybe we find something. That happens. I mean, it's just the way the tissue is. You've got fatty tissue, you've got glandular tissue, you've got dense tissue. So sometimes, it's just...
Yeah, it happens. Mm-hmm. Yeah, and other times, certainly it's more prevalent.
And you can feel something, but we can't find it. And
right.
Why is that? Well, sometimes, it's just based on that, and sometimes they'll do an ultrasound. Sometimes the patient will don't see it on mammo, but we see it on an ultrasound. There could be a cyst there. So it's just, that's why you use both tools together.
Mm-hmm. Then the cyst can be removed then at that time, if need be?
Aspirated,
or do they
with
just
a
go
needle,
away,
or
or-
it can go away, or they may do a 6-month follow up, or they have them come back, and we do some more imaging on again, and just make sure everything is staying stable.
Important that we get the screening done and make that appointment. How far out, are appointments being made right now?
As long as we have an order, we can get things in. I don't think we're pushed out too far at this point. We're not overbooked. I would say within a month you could get in, no problem. Depending on schedules and all of, everyone's schedule to put it together. But as long as we do need a doctor's order in order to do them. But then, once we have that, we can usually work things pretty quickly.
Are there some taboos about breast cancer, like some things that maybe aren't true that are out there? I mean, a lot of times if you go online, you're going to see things that are going to scare you. And
Well, people's friends sometimes
Yeah.
don't help very well. They say, "Oh, you're going to be bruised," or "It's just the worst exam I've ever had. It's so painful." And we always say it's uncomfortable, but it shouldn't. It for a few seconds of discomfort, I mean, it's worth it. We don't try to hurt anybody. That's not the plan. But some people think that you're going to get injured or bruised or.
not true. Anything, Jessica, you'd like to add?
No, like I kind of was saying before, we all do great at, feeling the person out, and we work together. It's not just us against them. If something doesn't feel right, we just need to know about it so that we can try to make it better.
We're doing this test together
Yeah.
and not to.
It's not as bad as most people, but again, you're not going around talking about how great it was.
Right.
You're going around saying,
Yeah,
that
so-
wasn't pleasant. So, that's just
And
the,
some people come in and say, "Well, that's all there is." Well, that was easy. That was easier than doing a, colonoscopy or something. I said, "Yeah." So it's, and they compare it to other tests. It is a quite easy, exam, and the information you get is well worth it. So.
Yeah, I can imagine that. But it's like a lot of things. I think if the first time you go in, it probably eases your mind a little bit, doesn't it, Jessica?
oh, yeah, definitely. And that's, a conversation that you can usually tell, when it's someone's first time and they're a little nervous. And usually at the end, it's like, that wasn't as bad as you were thinking, right? Like seriously. And usually they say, "No, that wasn't as bad." And, you have those few that, it doesn't matter. And it's gonna not be comfortable or happy. But I'd say it's usually not as bad as people are
Everybody's usually
anticipating.
pretty good about it, yeah.
Right.
Yeah.
So it should be a yearly plan then, or
That is up to your provider. Some providers like to do them yearly. They know your family history better than we do, so we do not make recommendations that way. We leave that up to their physician whether they should have their mammograms every 2 years or every year.
yeah, I didn't know if it was a part of the yearly health checkup that we should all have anyway. Then, but I guess to each their own. Then,
Yes.
from that
Let
standpoint.
the providers decide how they want to do their screenings.
We talked about at what age women should start. Do you continue those, into the elderly years and things like that as well?
Well, that's an interesting point. Everybody says, "Well, I'm 70 now. I can quit, right?" And I said, "Well, I guess we always, you look at your age and so you're pretty healthy. You're able to do everything real well. And I guess if we were to do a mammogram and you were to find something, would you treat it? And if you're going to say yes, then you continue to do your screening because your chance of breast cancer does go up as you get older."
And again, early detection is the main thing for any cancer, but I think maybe especially for breast cancer, isn't it, Jessica?
Yeah, I'd say so. Especially since we have the screening tools. There's a lot of cancers that there isn't screening tools, and and that's extra scary about a lot of them. Where this one we can screen it, we can kind of keep up on things. So let's do what we can to maybe take that out of the list of all the scary stuff we got to deal with.
Well said. So talk to your provider first, your main physician.
Yeah, so we do have to have an order in order to do this. So yeah, a lot of times it's from a physical You know, you go for your physical, they'll put in an order, and then we can go ahead and do that. It just needs to be more than a year for most insurances, which we try to keep track of also. But yeah, we do need the patient to talk to their doctor to get an order.
That's a good point, too. Most insurances cover this then, Marcia?
Yes, they do. It's just a matter of, like Jessica said, when we have insurances, you need to be, 11 months for Medicare. There are certain boundaries for that. So you just need to make sure we are out far enough that your mammogram is going to be covered, in the timely manner.
The Richland Hospital is hosting a blood drive today. We wanted to put in a plug for that as well, correct?
Yep.
You both are giving blood today, or you're probably working?
Planning on it.
Oh, you're planning on it. Well, that's good. So it goes on from 10 to 3 at the Richland Hospital and Clinics. Pippin Hall, appointments encouraged, but certainly walk-ins are always welcome as well. S. Murthy at impactlife.org is where you go for that to sign up for the blood drive at the Richland Hospital. Well, you two have been great guests. Anything else you'd like to add today?
Oh, thank you so much for having us.
Thank you for having us this morning. We appreciate that.
And we appreciate you coming in here. Very timely topic, Breast Cancer Awareness Month this time. And stop by the Richland Hospital for more information, again, on this or any subject that we have on the morning show. We're going to have some more topics coming up from the Richland Hospital as well to benefit our area. Thanks for joining us. We'll have more coming up in a moment.